our frailest seniors, and they would block grant that to the states, cut it almost in half over a number of years. That would dramatically, and maybe in devastating ways, affect care to our current seniors as they age.
Paul Ryan writes yesterday in the Wall Street Journal, absent reform, government programs designed in the middle of the 20th century cannot fulfill their promises in the 21st century. It is a mathematical and demographic impossibility, and we said so. That's from the Wall Street Journal. What do you specifically know yet what the Democrats will be proposing when it comes to Medicare, Medicaid, and those reforms beyond some reforms? Do you have a specific proposal?
Well, let me say we passed a specific proposal that's in effect, that is moving ahead, and can be very significant in transforming Medicare in a way that protects guaranteed benefits. Again, one of the significant differences here between the Republican proposal and where Democrats are is the Republicans would no longer guarantee benefits and coverage for seniors. They would give you a voucher and say, you go buy it in the private insurance system. We're not going to guarantee benefits anymore. You want additional benefits, you've got to pay for it. Costs rise, you've got to pay for it as an individual senior. You don't have the strongest negotiating power, by the way, as a senior. You may have some pre-existing conditions. You might actually be pretty ill. Insurance companies are not really anxious for your business in that regard, so it's very risky. But what we have done instead is to say, let's deal with the issue of rising costs. It is not possible for us to continue to pay the levels of increases costs in health care. So we had to deal with the underlying causes of those health costs. Republicans don't tackle that at all. They say basically you're on your own, buy it from the insurance industry, get what you can get. The extra cost is on you, maybe up to $6,000 an individual senior and rising. What we do instead is we say we want to transform the way we pay physicians and hospitals and health institutions to really demand more value for our dollar, to make sure that they are providing more coordinated care, providing the necessary care, reducing errors and readmissions to hospitals. These are not small changes. We're really pushing the healthcare delivery system in this country, which is inefficient and fragmented in too many places, to be more efficient, to be more coordinated, to get the right kind of care to our seniors and really to all of us, particularly for those with really chronic diseases, serious chronic diseases, the most expensive people to take care of. Let's do a better job. Let's improve quality. Let's save lives. Let's save dollars. And we're talking about billions of dollars in savings. So we're already on that path, and understand with the Republican budget, they would undo all of that important work that's happening right now to get us to a place where all Americans can see cost containment, not just in Medicare, but across the healthcare system.
Next call for Congresswoman Allison Schwartz comes from Kalamazoo. Ralph is a Democrat there. Go ahead, Ralph.
Oh, yes. I just wanted to remind people about the overspending under the Bush administration and the Paul Ryan's votes during the Bush administration that completely obliterated the surplus, the Clinton surplus. Paul Ryan voted for the Iraq War. He voted for the both rounds of the Bush tax cuts. Paul Ryan voted for the expansion of the Medicare Part D, which was unfunded, which increased the deficit. And Paul Ryan voted for the TARP, the Troubled Asset Relief Program, in 2008. So it boggles my mind that Paul Ryan is considered a budget expert when he, under the Bush administration, just basically blew the deficit and national debt right out of the roof.
Well, let me just say this is not just about Paul Ryan. This is the Republican budget, and the Republicans voted for almost every one of them last year. They'll vote for it again, and that vote for the Republican budget that's going to be voted on today in the Budget Committee and voted on the floor potentially next week. If they can reach agreement on the Republican side, there's still some disagreement there, but it is the Republican budget does do pretty serious damage, as I've been talking about, in terms of Medicare. And not only Paul Ryan, but every Republican will be held to account, as we all are, for our votes. But in this case, certainly, I hope the American people understand that, again, As Democrats, we are committed to deficit reduction. We believe that should be done in a balanced way. We believe that tax reform should be done in a way that respects and strengthens the middle class, and that we have to make the kind of investments that all of us care about for ourselves and our families. And yes, we have to protect Medicare. There are changes that we have to make in the delivery system, the payment reform. We have to reduce the rate of growth in costs under Medicare and across the healthcare system. But really, we're at a very challenging time in this country. We want to grow this economy, and we are going to see a Republican budget that many of us feel is not the way to meet these challenges in America and to be the strongest economy in the world as we move forward.
Steve is an independent in Lansing, Michigan. Steve, you're on the Washington Journal.
Hello. Yeah, thank you. Yeah, my question is pertaining to the Budget Control Act that the Senate put out last September that was signed in by both houses. And basically, let's see, Paul Ryan actually said that it's not the best deal, but 60% kind of went their way on tribal rules, whatever, what they wanted. And this is kind of how I'm looking at it. But this is supposedly the Budget Control Act, which is in law. So I don't know why Paul Ryan are coming up with another budget for 2013 when this budget was a 2-year budget. It was supposedly trying to eliminate any political arguments pertaining to going into the election, and another year after that, that whoever took office, that it wouldn't be another political issue after whoever did take the presidency. But so what is this Paul Ryan budget pertaining to what do I call it? The Budget Control Act, which was signed last year.
I think we got your point, Steve.
Thank you. Thank you. And actually, it's you are following this. So let me just say that, yes, there was agreement. This was the House Republican leadership and the White House and the Senate. And as we said, all right, we are going to agree on the spending caps already agreed to, but really on what the number would be in terms of how much more we would cut the deficit. The agreement was a little over $1 trillion, $1.04847, I think, and that was agreed to, and more than a handshake. You're right, we voted on it. And while we have to do appropriations bills for next year, not this year, the agreement was that, you're right, we would not have another sort of cliff. We would not create that sort of drama and angst and potentially shutdown of government. We would agree on what those numbers were going forward. And yes, you're right, Paul Ryan and Republicans have already reneged on that agreement. They have said the 1.048, sorry, it's $1 trillion, it's not enough. They want to reduce it to 1.02, it's 8 or 7, reduce it a bit more. And of course, there's some Republicans who are saying that's good enough. We should go under $1 trillion. I guess agreement, passing a law isn't good enough, and it creates a bit more anxiety and difficulty in what is already not an easy time to get things done. I will tell you, to grow this economy, create some stability, you know, Americans, whether Republicans or Democrats or independents, they want us to get things done. They want us to find that common ground. We reached agreement. I think we should stick with that agreement and not begin to play with reducing those numbers by another 10, 20, 30, 40 billion dollars. That creates a lot of uncertainty, not good for our economy, not good for us being able to find that common ground.
And as Allison Schwartz just said, this is the New York Times lead editorial this morning, the Careless House Budget. Very quickly, the New York Times writes, worst of all, it undermines a hard-fought agreement Democrats and Republicans made last August to set spending targets for 2013 under pressure from House conservatives. Mr. Ryan cut nearly $20 billion from spending levels set in the debt ceiling pact, breaking faith with the Senate and potentially leading to a government shutdown this fall. Much of that reduction is likely to come from programs like Head Start, Pell Grants for college students, and state aid. 3 very quick tweets that have come in. This is Shorty. Future generations will do without social safety net in old age if they don't fight for it now. Fire this guy, meaning Paul Ryan, I believe. Face It says, stop the spending, raise the taxes. And finally, Matt Smith says, the best thing we can do for the deficit is to grow the economy. The best thing to spur growth, government spending. Next call for Allison Schwartz comes from Yucaipa, California. Valerie, Republican line, you are on the Washington Journal. Yucaipa. Valerie. All right. Time to move on to Sarasota, Florida. Gordon, Independent Line. Hi, Gordon.
Hi, good morning. How are you doing?
Please go ahead with your comment or question, sir.
Representative, my congressperson is a car salesman. What's your educational and work experience background to make the comment that you can't balance the budget by cutting spending? That doesn't really hold any weight with me. And then secondly, you made speak in one sentence. You said the Republicans want to balance the reducing benefits to the seniors, and then in the next breath you stated that we can't sustain the current health spending. So which is it? Thank you.
And who's your congressman, Gordon? Well,
lost him.
Right.
So let me just say that first of all, we have already agreed that we should cut spending. That's not the question. We've agreed. And feel strongly, I do certainly, about the need to reduce the deficit. But we have to do it in a balanced and responsible way. And the same thing about the issue of health care in this country. I believe we start with a promise to our seniors. Really, when we passed Medicare, there was a lot of controversy about it then. Certainly Republicans have been concerned about it, its whole existence. But I believe that we start with a promise of Medicare to our current seniors and to future seniors. And what that means is guaranteed benefits and beneficiaries being able to count, our seniors being able to count on Medicare. How we contain the rate and growth in costs, that's the question. So it's not at all inconsistent for me to say I want to protect Medicare and I want to be able to contain that rate of growth in costs so it is sustainable. That's very different than what we're hearing from the Republican side. The Republican side is saying the only way we can maintain Medicare, any commitment to Medicare, is to walk away from it and to say basically, you know what, priority is government's got to cut spending. It's on you as an individual senior. I don't care how sick you are, I don't care how frail you are going to have to pick up the difference in terms of rising rate of growth and costs. That's a problem to me. I think we should take that responsibility in pushing the healthcare system to really contain the rate of growth and costs and help make sure that we can sustain it. But it starts with that promise. It starts with the promise to seniors in this country.
Allison Schwartz spent about 14 years in the Pennsylvania State Senate before being elected to the Congress 4 terms ago. She has a master's from Bryn Mawr College. What's your master's in?
In social work.
And prior to joining politics...
Elected office, yeah.
Right.
Yeah, I worked in the healthcare sector. I started and ran a health center, so I was responsible for budgets and payrolls and figuring out how to make ends meet. And certainly in the state Senate, the states are required to balance their budget. And I feel pretty strongly about the need to be fiscally responsible and to be able to make sure that I think we should pay for what we spend in this country. Look, we've come out of a very difficult economy. I think everyone should understand that. Yes, deficits did grow under a previous president. We inherited a terrible economy. It's taking a while to grow out of that terrible recession that we were in. We want to see grow faster. We want to be strong as an economy. We need to do that. And I would like to see us move towards a balanced budget. So it is really important to me that we continue to tackle the issue of spending and deficits. But every responsible bipartisan commission has said we can't simply do it by spending cuts. And again, we've already agreed to $3 trillion in spending cuts. The president's budget has $5 trillion in spending cuts. This is serious business. It's a lot of cuts. Some of these are painful decisions for us. I'm willing to make some of those tough choices. But it's also not fair to Americans to say taxes, particularly taxes on our wealthiest Americans, asking them to pay a bit more, getting rid of tax breaks for the big oil and gas companies that are making a lot of money, are no longer necessary. Let's tackle these issues about tax deductions for special interests and reduce the corporate tax rate. That's important, but we really need to do it in a really balanced and fair way. Otherwise, what we're going to do, and what the Ryan Republican budget does, it really protects tax breaks for the wealthiest corporations and Americans on the backs of the middle class.
Representative Schwartz's district includes parts of northeast Philadelphia and Montgomery County. Ravenna, Ohio.
All of this online in our video library at cspan.org, as is today's markup session of the House Budget Committee. The House gaveling back in now for a series of votes.
Adopting HRES 591 if ordered, suspending rules concurring to the Senate amendment to H.R. 886, and agreeing to the Speaker's approval of the journal if ordered. The first electronic vote will be conducted as a 15-minute vote. Remaining electronic votes will be conducted as 5-minute votes. The unfinished business is a vote on ordering the previous question on House Resolution 591, on which the yeas and nays were ordered. The clerk will report the title of the resolution.
House Calendar Number 119, House Resolution 591, Resolution providing for consideration of the bill, H.R. 5, to improve patient access to health care services and provide improved medical care by reducing the excessive burden the liability system places on the health care delivery system.
The question is on ordering the previous question. Members will record their vote by electronic device. This is a 15-minute vote.
The House back from a short recess. Before that recess, they had been debating the rule for a bill that would repeal part of the 2010 health care law, the part dealing with the Independent Payment Advisory Board. The bill would also place some caps on some medical malpractice awards. This is the previous question vote. Democrats urging their members to vote no in order that they can allow for consideration of a House version of the Senate Surface Transportation Bill. This as the Republicans plan to offer a 90-day extension. CQ says that John Mica, the Transportation Committee, says he'll introduce a 3-month extension of the highway and transit programs through the end of July. But this 15-minute vote, the previous question vote, a vote on the rule for the health care repeal bill dealing with the payment board, that rule vote is coming up next. And the rule would allow for 6 hours of general debate and consideration of some 6 amendments. Over in the Senate, meanwhile, they've been debating a small business bill, and they did vote today to cut off debate and move the legislation toward passage. The vote there was 76 to 22. Look for some possible amendment votes this afternoon as the Senate aims to wrap up work on that bill. Also today on Capitol Hill, the House Budget Committee has been meeting throughout the day, marking up the Republicans' 2013 budget proposal. That hearing's underway. We're carrying it live all day on C-SPAN 3 and also cspan.org, although it's likely to break in just a little bit due to this series of votes on the House floor. We also covered a hearing this morning with the Federal Reserve Chairman Ben Bernanke and Treasury Secretary Tim Geithner testifying before the House Oversight Committee about the European financial crisis. I want to show you the opening statements by the Treasury Secretary and the Fed Chair as this 15-minute vote continues.
Thank you, Mr. Chairman and Ranking Member Cummings and members of the committee. Thanks for giving me a chance to come talk to you today about the crisis in Europe and its risks and implications for the United States. This is going on for more than 2 years, of course, but we welcome the attention you're bringing to this important question. Europe is a key strategic and economic partner of this country, and we have an enormous stake in the success of Europe's efforts to avert a catastrophic financial crisis. Our economy is gradually getting stronger, but of course we still face a lot of tough challenges here in the United States. Among those challenges, of course, unemployment is still very high, housing market still very weak. We still have a long way to go to repair the damage caused by our crisis, but we also face a challenging and uncertain global economic environment with the risks around Iran adding to upward pressure on oil prices and Europe facing a long and difficult crisis. Europe, the euro area, accounts for about 18% of global GDP. It's a major source of financing for many emerging economies. It accounts for about 15% of U.S. exports of goods and services, but a larger portion of the exports of many of our trading partners. When growth slows in Europe, it affects growth around the world. And when the fears of a broader European crisis have been most acute, as they were in the summer and fall of 2011, and earlier in the spring and summer of 2010, then financial markets fell around the world, damaging confidence and slowing the momentum of recovery here in the United States and around the world. Now, over the past few months, with our active encouragement and support, Europe's leaders have put in place a more comprehensive strategy to address the crisis. This strategy has the following key elements. First, it involves economic reforms, very tough reforms in the member states to restore fiscal sustainability, to restructure, recapitalize banking systems, to improve the competitiveness and growth prospects of their economies. Second, it includes broader reforms to the institutions of Europe, including the fiscal compact that establishes stronger disciplines on the fiscal policies of the member states to limit future deficits and debt as a share of GDP. It involves a coordinated strategy to recapitalize, as I said, the European financial system with government backstops for funding. And it involves a firewall, a financial firewall of funds to provide financial support to governments that are undertaking reforms so they can help retain access to financing on sustainable terms. Now, these reforms have been aided by a number of actions by the European Central Bank, and together these efforts have helped calm financial tensions somewhat. But Europe is still at the initial stages of what will be a long and difficult path of reform. And for these reforms to work, policymakers in the euro area are going to have to carefully calibrate the mix of financial support and the pace of consolidation, fiscal consolidation ahead. These reforms, these tough economic reforms, are not going to work without financial support that enables governments to borrow at affordable rates. And if every time economic growth comes in a little weaker than expected, governments are forced to cut spending or raise taxes to compensate for the impact on deficits, this would risk a self-reinforcing negative spiral of growth-killing austerity. The most important unfinished business of this broader financial strategy in Europe is to build a stronger financial firewall. The European leaders are now reviewing options for how to expand the combined financial capacity of their two funds so they can make it clear to markets that they have the resources available on a scale that is commensurate with the needs they might face were the crisis to intensify in the future. As you know, the IMF has played an important role in Europe. IMF has provided advice on the design of reforms, a framework for public monitoring of progress, and financial support for programs in Greece, Ireland, and Portugal. That financial support has come alongside a much larger amount of financial support from the European nations themselves, as is appropriate. It is in the interest of the United States that the IMF continues its efforts in Europe, but the IMF's resources cannot substitute for a strong and credible European firewall. The IMF has played a major role in every major post-war financial crisis while consistently returning to the United States any resources with interest that it is temporarily drawn upon. Our commitments to the IMF are backed by very strong financial safeguards, and in more than 60 years of experience dealing with financial crises, we have never lost a penny. Over the past 18 months, the crisis in Europe has taken some of the wind out of our recovery. We are encouraged by the progress that our European colleagues have been making. We hope they're able to build on these efforts in the coming weeks to put in place a more durable foundation for economic growth and a stronger financial firewall. We do not want to see Europe weakened by a protracted crisis, and so we're going to continue to work very closely with them and with the IMF to encourage further progress. Thank you.
Thank you, Mr. Secretary. Chairman Bernanke.
Thank you, Chairman Issa and Ranking Member Cummings, for inviting me. As you know, for about 2 years, developments in Europe have had an important influence on global financial markets and the global economy. High debts, large deficits, and poor growth prospects have led to big increases in sovereign borrowing costs, concerns about fiscal sustainability, first for Greece, but subsequently for other countries as well. And pessimism about countries' fiscal and economic situations has in turn undermined confidence in the strength of European financial institutions. This has had an impact on the U.S. economy. The European Union accounts for about 1/5 of U.S. exports of goods and services, and we have seen those exports underperform. And, of course, Europe also affects the rest of the world. Financial strains have been evident during times when financial conditions in Europe were the most turbulent. We saw a global retreat from riskier assets. In the United States, those pullbacks from risk decreased stock prices, increased the cost of issuing corporate debt, and affected consumer and business confidence. And we've also seen our own financial institutions, thought to have substantial exposures to Europe, see their stock prices fall and their credit spreads widen. We've seen some improvement. Financial stresses in Europe have lessened in recent months. which has helped improve the tone of financial markets around the world, including in the United States. Several actions by European policymakers have contributed. First, the actions by the European Central Bank to undertake 2 longer-term refinancing operations that have helped European banks lock in their funding. The European banks, in turn, have increased their holdings of sovereign debt, which have lowered borrowing costs for some countries. Secondly, euro area leaders, including the Greek government and private sector holders of Greek debt, have been taking steps to put Greece on a more sustainable fiscal path. With its sovereign debt significantly reduced, the Greek authorities are intensifying their efforts to implement fiscal and structural reforms, and the EU and IMF have pledged a considerable amount of new funds as part of a second assistance package. However, the Greek economy remains in a deep recession. The third positive step has been the approval of a new fiscal compact treaty among the members of the EU. This treaty is an important step towards resolving the fundamental tension inherent in having a monetary union without a fiscal union, and that should help bolster the viability of the euro area economy in the longer run. Although progress has been made, more needs to be done. Secretary Geithner discussed some of these issues: further strengthening of the European banking system, an expansion of financial backstops or firewalls to guard against contagion in sovereign debt markets, and critically, we need continued efforts to increase economic growth and competitiveness and to reduce external imbalances in the troubled European countries. The Federal Reserve has been following these developments closely, and we've been in frequent contact with key European policymakers. Our focus, of course, is to protect U.S. financial institutions, businesses, and consumers from any adverse developments occurring in Europe. To help calm dollar funding markets and to support the flow of credit to U.S. households and businesses, the Federal Reserve acted in concert with major foreign central banks to enhance the U.S. dollar swap facilities, as has been testified before this committee. Use of our reestablished lines was limited until late last year. However, in late November, we agreed with the ECB and the central banks of Canada, Japan, Switzerland, and the UK to extend the swap lines through February 2013 and to reduce their pricing. The lower cost of the ECB and other foreign central banks has in turn allowed them to reduce the cost of short-term dollar loans that they provide to financial institutions in their jurisdictions. As was noted, the swap line increased considerably and peaked at $109 billion in mid-February. This has had a very beneficial effect on easing dollar funding pressures in European and other foreign banks, which has in turn lowered tension in U.S. money markets, alleviated pressures on foreign banks to reduce their lending in the United States, and has boosted confidence at a time of considerable strain in international financial markets. As market conditions have improved notably, usage of the swap lines has fallen back. It's currently about $65 billion. I would add that the swaps are very safe from the perspective of the Federal Reserve and the U.S. taxpayer. They present no exchange rate or interest rate risk. Each drawing has a short maturity and must be approved individually by the Federal Reserve. They are collateralized by the foreign currencies for which the dollars are swapped, and our counterparties are the foreign central banks, not the commercial banks who are receiving the dollar loans. Fed has also worked with the FSOC and other agencies to monitor our financial institutions. Notably, U.S. financial institutions have very limited direct net credit exposures to the most vulnerable euro area countries, and U.S. money market funds have almost no exposure to those countries. There are some exposures arising from the sale of credit default swaps on sovereign debt, but our assessment is that those are broadly hedged with CDS in the other direction, and that the counterparties to those CDS are broadly dispersed and are strong banks in Europe. Although U.S. banks have limited exposure to peripheral European countries, their exposures to European banks and to the larger core countries is much more material. Moreover, European holdings represent 35% of the assets of prime U.S. money market funds in February, and those funds remain structurally vulnerable despite some constructive steps taken since the recent financial crisis. So the risk of contagion does remain a concern for both those institutions and for supervisors and regulators. In particular, were the situation in Europe to take a severe turn for the worse, the U.S. financial sector likely would have to contend not only with problems stemming from its direct European exposures, but also with an array of broader market movements, including declines in global equity prices, increased credit costs, and reduced availability of funding. Most recently, the Fed released on March 13th the results of our Comprehensive Capital Analysis and Review, or CCAR, which is essentially a stress test of the largest banks or bank holding companies. We imposed a hypothetical stress scenario on these banks that involved a deep recession in the United States with unemployment reaching 13%, a decline in activity abroad combined with sharp decreases in both domestic and global asset prices. This exercise was designed to capture both the direct and indirect exposures and vulnerabilities of U.S. financial institutions to economic and financial stresses that might arise from a severe crisis in Europe. The results show that a significant majority of the largest U.S. banks would continue to meet supervisory expectations for capital adequacy despite large projected losses in an extremely adverse hypothetical scenario. So in conclusion, the recent reduction in financial stress in Europe is welcome, given our important trade linkages. The situation, however, remains difficult, and it's critical that European leaders follow through on their policy commitments to ensure a lasting stabilization. I believe that our European counterparts understand the challenges and risks they face, and they are committed to take the necessary steps to address those issues. And for our part, the Fed will continue to monitor the situation, work with our financial institutions and foreign counterparts to strengthen our financial system, and be ready to use the tools at our disposal to help stabilize U.S. markets should the situation require such action. Thank you.
It's a House hearing from earlier today. We'll have all of it later in our program schedule on the C-SPAN networks, and you can also see it anytime in the video library at cspan.org. The House earlier today had been debating the rule for a bill that would repeal parts of the President's health care plan, the health care law of 2010, the parts related to the Independent Payment Advisory Board. The bill would also place caps on some medical malpractice awards. They're in the first of a series of 4 votes. This is the previous question vote, as Democrats looking to offer an amendment to the rule which would allow for consideration of the House version of the just-passed Senate transportation bill. This is a 15-minute vote. They will vote on the rule next, the rule for the health care repeal bill, and that rule would allow for 6 hours of general debate and a number of amendments as well. They're not going to finish that bill today. It will continue into tomorrow. Meanwhile, on Capitol Hill, the House Budget Committee hearing is in a recess. They've been meeting all day, marking up the Republican budget proposal for fiscal year 2013, the one announced yesterday by Paul Ryan. That hearing will gavel back in once this series of votes is wrapped up, and we'll continue our coverage on C-SPAN 3, and you can also follow it online at cspan.org. So a 15-minute vote here, 3 5-minute votes will follow.
On this vote, the yeas are 231, the nays are 179, one voting present. On adoption of the resolution. As many as are in favor will signify by saying aye. Those opposed will say no. In the opinion of the chair, the ayes have it.
Mr. Speaker? Mr. Speaker?
Gentleman from Massachusetts.
On that I ask for a recorded vote.
Recorded vote is ordered. Those in favor of recorded vote will rise and be counted. Sufficient number having arisen, recorded vote is ordered. Members will record their vote by the electronic device. This is a 5-minute vote.
Here's a vote on the rule to a bill that would repeal part of the 2010 health care law dealing with the Independent Payment Advisory Board. The bill would also place some caps on medical malpractice awards. 5-minute vote on the rule, and that allows for 6 hours of general debate. 6 amendments will be considered. It's expected that the House will get through general debate today and amendment debate on Thursday. They gavel in on Thursday at 10 a.m. Eastern. Over in the Senate, they are moving forward with the small business funding bill. They invoked cloture, voting 76 to 22 to limit debate on the House-passed bill. Senator Harry Reid saying he expects to finish work on the bill before 6 p.m. today. Votes on 2 Democratic amendments are expected ahead of that. The Senate is live on C-SPAN 2, and a tribute underway to the longest-serving woman on Capitol Hill in Capitol Hill history, Senator Barbara Mikulski. That's underway now over on C-SPAN 2. And shortly on C-SPAN 3, the House Budget Committee will gavel back in for resumption of their markup session on the Republican 2013 budget proposal.
On this vote,
Mrs. Roby. Green. Mrs. Roby votes aye. Mr. Schiff. Mr. Schiff votes no. Mr. Gomert. Mr. Gomert votes no.
on this vote, the yeas are 233, the nays 182, one answering present. The resolution is adopted, and without objection, the motion to reconsider is laid upon the table. The unfinished business is a vote on the motion of the gentleman from Ohio, Mr. Stivers, to suspend the rules, concur in the Senate amendment to H.R. 886, on which the yeas and nays were ordered. The clerk will report the title of the bill.
H.R. 886, an act to require the Secretary of the Treasury to mint coins in commemoration of the 225th anniversary of the establishment of the nation's first federal law enforcement agency, the United States Marshals Service.
The question is, will the House suspend the rules and concur in the Senate amendment? Members record their vote by electronic device. This is a 5-minute vote.
The House approves the rule for debate on a bill that would repeal the Independent Payment Advisory Board, part of the 2010 health care law. It would also place caps on some medical malpractice awards. So ahead, 6 hours of general debate today, and then tomorrow they will take up 6 amendments, proposed amendments to that bill. The House is in tomorrow at 10 a.m. Eastern. This is a vote on a bill that recognizes the 225th anniversary of the U.S. Marshals Service, the oldest federal law enforcement agency. First one's appointed by George Washington in 1789.
ayes, 2 answering present. 2/3 being in the affirmative, the rules are suspended. The Senate amendment is agreed to, and without objection, the motion to reconsider is laid upon the table. Pursuant to Clause 8 of Rule 20, the unfinished business is a question on agreeing to the Speaker's approval of the journal, which the Chair will put de novo. The question is on agreeing to the Speaker's approval of the journal. As many as are in favor will signify by saying aye. Those opposed say no. In the opinion of the Chair, the ayes have it. For Massachusetts,
On that I ask for the yeas and nays.
are requested. Those in favor of the yeas and nays will rise and be counted. Sufficient number having arisen, the yeas and nays are ordered. This will be a 5-minute vote. Members will record their vote by electronic device.
It's the last vote in this series. I had 6 hours of general debate on a bill that proposes to repeal part of the 2010 health care law dealing with the Independent Payment Advisory Board. It would also place caps on some medical malpractice awards. 6 hours of general debate expected to wrap up this evening, and then the House will take up amendments to that bill tomorrow. They're in at 10 o'clock Eastern, and of course we'll have live coverage. And it might be a pretty good preview to next week's 6+ hours of oral argument on the health care law before the Supreme Court. Oral argument Monday through Wednesday of next week, and we will bring you coverage each day of the same day audio. As soon as they're released, we will air it for you with coverage on C-SPAN 3, C-SPAN Radio, and cspan.org.
The yeas are 308, the nays 101, 3 answering present, and the journal stands approved. For purpose, the gentleman from Indiana rise.
Mr. Speaker, I rise today to ask unanimous consent that I be removed as a co-sponsor on H.R. 3697.
Is there objection? Without objection, so ordered.